Welcome and good morning, everyone, to this multinational panel on the Magnet for Europe study, which is based on the Magnet Recognition Program. I'm Dorothea Kohnen, and I will moderate the session together with the three panel members here. I'm very pleased that we can actually be here at the BGW forum, getting the opportunity to present the project. I'm originally from Germany, but I live and work in Belgium, where I'm doing my PhD and also work as a project manager for the Magnet for Europe study at the Catholic University of Leuven. So today's session will consist of three main parts. I will first give a short presentation overview of the project. What is it about? Who is involved? What are our main activities? And I will also give you a little bit of background information on the magnet concept in general. Then we will have a general discussion with the three panel members. We have panel members from Germany, but also from Ireland, who can give us some insight actually on how magnet works in practice here in Europe. The focus of this discussion will be mainly on the main motivation of the hospitals to join the project, how the pandemic impacted the project, because we started right after the pandemic actually, or right before the pandemic happened. And then we will also discuss how the panel members assess the implementation, the application of the magnet model. So the magnet model is actually something that comes from the US, and we will discuss how the panel members evaluate the adaptation of this concept in the European context. And then we also want to discuss some individual initiatives that have been developed and introduced in the hospitals as part of the Magnet project. So every one of them brought some specific examples that we can actually see how Magnet works in practice. So, not to lose too much time, I'm going to start with the presentation of the project. Magnet for Europe, as the name already indicates, focuses on the European context. So it takes place in 6 European countries. We have Belgium, Germany, Ireland, Norway, Sweden, and the UK, where it aims to implement the so-called magnet model in more than 60 hospitals in order to improve the working conditions for nurses and physicians, in order to improve the working environment and to improve also their well-being and mental health. The project runs for over 4.5 years, so we started in January 2020, right before the pandemic happened, and we will officially, so the project received funding from the European Commission, and the official funding period will end in summer next year, but of course we hope that our hospitals will continue to work on their activities beyond the official end of the project. It's a very big project, as you can see. It's coordinated by several institutions in the different countries. We have 8 universities in total that are partnering in this project. We have a Belgium small-medium enterprise who's doing the data collection for us, and we are also very pleased to have the University Hospital of Antwerp participating in this project because they were the first obtaining magnet designation in Europe. So the project in total is coordinated by KU Leuven in collaboration with the University of Pennsylvania. In Germany, we have the Technical University of Berlin, and since also Ireland is joining us today, they are mainly represented by the University College Cork in Cork. So at this moment in time, we have 62 European hospitals that are participating in the study. And then one essential component in this project is the twinning. I'm coming to this in a moment, but it actually means that each European hospital is working together with a US magnet-designated hospital on the intervention. That really helps them because they are the expert on this model, so they really help them to introduce the concept in their hospitals. So this means our study covers actually the participation of over 120 hospitals in 7 countries, and to our knowledge, it's the most ambitious project that we are aware of that really aims to redesign the complex work environment in hospitals with an evidence-based intervention. So before we're looking at the Magnet intervention, our Magnet for Europe intervention in detail, I would also like to give you some background information on the Magnet concept. The concept has been developed over 40 years ago in the American context, and it basically started with a study in the early 1980s that tried to explain why some hospitals were able to recruit and to retain nurses during a severe nursing shortage. So even more, the researchers found that some hospitals seemed to be kind of immune to this shortage because they were still able to attract and to retain nursing professionals. And this is what they called the magnet effect. So they found that these successful institutions, they showed some immunity towards this shortage. They had specific characteristics in common, 14 in total actually. And among them, I don't count them all in total now, but among them were flat organizational structures, much less bureaucracy than the average hospital, with a very much more engagement of clinicians, not only in clinical areas, but in all kind of decisions in the hospital. They had much more autonomy, and there were some other characteristics. But based on these findings of this study, the American Nurse Credentialing Center developed the Magnet model, and even more, they introduced the Magnet Recognition Program to recognize healthcare organizations that provide nursing excellent practices. So the main idea was that many more hospitals will implement this concept, they will follow the other institutions, and they will strive for this recognition program in order to overcome this nursing shortage and high turnover rates. So Magnet is really about becoming better, not obtaining the status quo. So once a hospital obtained Magnet designation, the idea is after 4 years to obtain the redesignation. So it's really fostering nursing excellence. So with this 40 years of history, one can say, the Magnet concept has a huge tradition in the American context, where it has proven its success not only in practice, because nowadays we can find several hundred Magnet hospitals in the US, also in Saudi Arabia, in Japan, in Australia. But it also has proven its success in research. And what we know from this research is that Magnet hospitals, they're associated with better work environment. And in particular, that this good work environment translates into better clinician well-being. But despite the large body of evidence, Magnet so far has not taken hold in Europe. And this is what we wanted to change with Magnet for Europe. So the idea was really to test this in an interventional sense. Does it really work? And to implement it in over 60 hospitals in these 6 different countries, to really build it up in the European context. And what is also unique about this project is that we extended scope by also including physicians, because so far, coming from a traditional perspective, the Magnet so far has mainly focused on nurses. So in doing so, we are mainly, or the intervention will mainly consists mainly of 5 main components: the original Magnet manual that we got from the ANCC, and the gap analysis tool that helps hospitals to identify areas to be improved. They're doing it 2 times, one at the beginning of the project and one at the end of the project. Then, as I said, every European hospital is twinned with a Magnet-designated US hospital, which really helps them with the implementation. They both, like all hospitals in Europe and the US, participate in learning collaboratives. So they are coming together. During the pandemic, it was mainly online, it was every month, but we also started to have in-person collaboratives. The first one was in Cork, the second in Oslo now this year. So they are coming together, they're presenting their work, they're sharing best practices and their experiences with the project. So it's really about building this critical mass, because it has been shown that a huge network can actually help with the implementation of such a concept. Not only at the national level, because hospitals can also meet within their country, but at the international level, because all of the hospitals, they're coming together. And then, of course, it's a research project, so we're frequently evaluating, we're surveying the hospitals, After each measurement occasion, they're receiving a feedback report from us on how they are doing. Okay. This is already the end of the presentation of the project, and I'm now happy to give the floor to our panel members. So first, I'm very pleased to introduce Marie Callaghan from Letterkenny University Hospital from Northwest Ireland. Marie has been a clinical nurse for over 20 years, working in various acute areas in 3 different countries. She specialized in emergency nursing and worked in the emergency department in Letterkenny for 16 years as a staff nurse and then as a clinical nurse manager. She also worked in the emergency department throughout the pandemic, prior to her appointment as Magnet coordinator in October last year. Welcome, Marie. Our second member is Marion Kühn from Hospital Bergmannstrost in Halle here in Germany. Marion holds a degree in organizational psychology and a master in business administration. She's working at the hospital since 2017, where she's head of strategic HR management, which includes topics such as HR development, health and well-being, recruiting and controlling. In addition, she's co-leading the Magnet for Europe study together with the chief nursing officer at her hospital. Welcome, Marion. And then last but not least, I'm pleased to introduce Dr. Sonja Freyer from the hospital Bremerhaven, where she is employed since 2019. She's a nursing scientist by training and holds a position as advanced practice nurse mental health care. In addition, she's a member of different project groups in the course of the Magnet for Europe study. Welcome. Okay. Okay. I would like to start with the first question. I already said it, and we would like to discuss a little bit of the hospital's motivation to join the project. Let's look at the key factors that convinced your hospital to participate in the project. Marie, what would you say?
Well, our director of nursing had always had an interest in the Magnet model and I suppose the evidence behind it and I suppose watched with interest the increasing body of evidence coming out about Magnet hospitals. So she, when the opportunity came along, really jumped at the opportunity. She was determined that Letterkenny would be involved. We were also very lucky, I suppose, that one of our nurse management team had actually worked in a Magnet hospital in Saudi Arabia. So she was very passionate about what the Magnet model could bring to an organisation, and I suppose she saw firsthand the benefits to the staff and the patients. So I suppose that they were the main factors involved in the initial participation in the Magnet for Europe project for Letterkenny.
Yeah. What would you say, Marion? Was it similar or?
Our main motivation was that we, as Bergmannstrost, took part in the RN forecast study, which was the study right before, I would say, before Magnet for Europe came. It was the largest study and survey of nursing within Europe, and out of this study, we, as Bergmannstrost, were at a good level, but nevertheless, we saw main areas where we could improve. And those were like cooperation and leadership, development of staff, resources, and also good clinical practice. And when you look at the Magnet components, then you find everything in the model. So for us, it was a natural development to take part in this study because it was the ultimate chance to work on those things.
Yeah.
Yeah.
Interesting. And how about you, Sonja?
So when I started at the KBR, at the Klinikum Bremerhaven, the chief nursing officer had the vision to get to a Magnet hospital, and then we had the possibility to get to the Magnet for Europe study, and we would be very happy. And for us, it was a very important thing that the shortage of skilled workers was a decisive factor for participation. So as you said, it's very difficult to have enough nurses at the bedside care, and we want to improve the quality of care. It was a very important aspect for us, and so we were very happy to get at the Magnet for Europe study.
Yeah, it's interesting because the main motivation, like to start the study 40 years ago, like it's still valid. I mean, we're still facing similar challenges, or actually the same challenges, finding the right staff, finding good staff. There's a shortage still, visual, yeah. And then for our audience, we recruited the hospitals in a two-stage process. So first, hospitals were asked, when we were writing at the grant proposal, they were asked to communicate their interest to join the study. But that was before we actually received the funding. So when we got the funding eventually, we asked them again, do you want to participate? Do you want to sign a kind of participation agreement? And that was actually already during the time when the pandemic was about to start. So I would now be interested in how was the participation communicated to the staff, and how was it perceived? Did you felt there was a kind of resistance coming from the staff?
Me to start. I suppose, I think the pandemic kind of put a lot of things on hold, or sent them not the way things had intended to go. I think in the initial phase, our director of nursing had got a group of senior nursing managers together, and they had looked at the gap analysis. They had also met with the twin hospital, and I suppose looked at the Magnet documentation, and that I don't think fully it was communicated to staff until the pandemic had settled a little bit. We really only started communicating properly with staff about it. The second survey was May 2022, so we used the opportunity. It was International Nurses Day. We used that as a big launch day, and tried to sort of create a bit of a buzz and start communicating with staff about Magnet for Europe and what it really was, etc., and really put a lot of emphasis on the survey, and that we needed to know what was wrong before we could fix it, and before we could look at things properly. I suppose when I came into that's how I initially got involved, was sort of as a Magnet champion in the initial phase, before my job came up. But when I started in post, I suppose coming from the clinical environment and knowing very clearly, I suppose, the difficulties that arise in communication, that kind of top-down communication, I wanted to make it very, very bottom up. So I focused on actually, and I also know that it was difficult in a clinical environment to, even if you were interested in a topic, there was a talk on, or there was a discussion about something or a presentation, you weren't always in a position to leave the clinical environment to actually go and see that talk or find out more information. So I focused on actually going to the individual units and giving smaller presentations and having that face-to-face discussion with staff, and I suppose creating that opportunity to have a less intimidating discussion, and sort of inviting the cynicism that it could be addressed there and then. So I suppose that's how we communicated it with staff. But you asked as well about challenges,
like if there were perhaps some resistance, because I mean there was a lot of pressure on the hospitals, especially like in the first 2 years.
Yeah, absolutely. And I suppose we were very much aware, and I suppose I worked in the emergency department throughout the pandemic, and very acutely aware of the pressures that staff had been under and were still under. Staff were stressed and burnt out. But I suppose from my point of view, what better time that this intervention was needed, desperately needed. And I suppose, yes, there's obviously cynicism, and there's obviously resistance to change, and I suppose the change was, people were used to change throughout the pandemic. They'd shown themselves to be resilient, to find new ways of working, but also they were tired of change. But I suppose to channel that, we'd found during the pandemic, staff are coming up with new ways of working. They were finding new ways of doing things, and we just wanted to channel that, I suppose, through the magnet model. So addressing things head on, I think, is a good way to address resistance.
How was with you? Like, how would you say, did you communicate it, and how were people reacting?
Maybe I first want to grab up your thought about the pandemic, because of course it was a special situation during 2020 and 2022. And I think it was for all hospitals all over the world, it was a state of emergency for 2 years. It lasted so long. And we were asking ourselves the question also within the Magnet team. We were asking, what comes after the pandemic? What will be left from us after COVID? We thought, okay, Magnet sets the focus on those things and those structures that we have to implement, that when the pandemic is over, there is still something that is good for the staff, that makes them retain at our hospital and not leave the organization. So for us, it was the way also out of the pandemic. And so we communicated at different levels. We communicated through, I think, the classical channels like posters, papers, flyers, things like that. We have little stand-up posters at every ward where we continuously inform our staff what is going on. We have an intranet website where everybody can inform themselves, and this year we will do the next step, because it's a difference if you just communicate and inform people or get them involved. So this year we are trying to involve more people in the Magnet project. We're going on every ward. We're doing workshops. We want to find out what the concerns about Magnet are on each and every ward, and also what potential staff nurses see. And the goal is to find multipliers for Magnet on each ward. The best constellation might be a nurse multiplier, a physician, and also a therapist. Then we would have a 3 multiplier Magnet team on each ward that could, get the things done that need to be done within Magnet.
Yeah.
So, and we also use them for the communication with the staff, the classic channels, as you said. So we have a staff newspaper. So there were some articles about the Magnet for Europe study, and then the staff wards were informed about the participation in the study of the ward managers, and we also have made some posters in the hall of our hospital, and then via the intranet we introduce the employees and the nurses and doctors and all about the project and our first activities.
It's cool. We already addressed it, we touched upon it. I want to look a little bit more on the impact of the COVID pandemic. Marion, you were also saying it, it was a very special situation. It was a kind of emergency case for a long, long time, and no one really knew when it was supposed to kind of end, like where would be the end and how would it end. How would you say, did you reallocate capacities, and what made you stay engaged in this intervention or in this project to really keep on focusing on the different activities?
So we definitely had to allocate our resources during COVID, because there were so many other operational tasks that, of course, Magnet was not the priority one. But what made me feel focused or stay within Magnet was the project team. I have a fantastic project team at our hospital that stands behind Magnet, and also our top management who says that's our strategy, that's where we want to go. And that makes me feel very strong and convinced about that this is the right way that we're going. And as I said before, for us it was like the strategy out of the pandemic. Mm-hmm. So that was the main focus, yeah.
And can I ask, like this comes on top to your general position,
yes.
so it's not
yes.
that you're having like 40-60% or 70-30, it comes on top.
It comes on top, yeah.
That's really impressive.
I don't get any extra time for the project, but I think it's the same with Marie and also with you. Yeah.
That's very impressive. Yeah. How would you, would you describe the situation at your hospitals? How were tasks reallocated? Did you postpone something or?
So in the COVID-19 pandemic, the project team capacity on the Konzept was not changed during the Konzept because the vision to stay at the Magnet for Europe study and to improve the things. So we try to make all the things that we want to do in this project, and so we the project members investierten die Zeit to invest the time for the project, and on top, as you said, so we wanted to do the things and we have the goal, and so we did our work in this project to push it going forward.
Yeah, just to get a better idea, how big are your teams, more or less?
So we have 3 key coordinators, and then we have also project teams with more about 50 members in the different project teams. But we have had 3 coordinators who did the main work and have everything in blick in the mind.
Just having the strategic
Thank you.
vision of the project. Okay.
Yeah, it's nearly the same at our hospital. So we have a project group of 6 people, interprofessional, and then we have 3 people who are the main who stand for their profession within the hospital for Magnet. 1 physician, 1 nurse, and 1 therapist. And then we have the project teams underneath on every ward. So it's quite hard to count how much people are involved. Yeah.
That's nice. Marie, how was it at yours in Letterkenny?
We have a steering group that has representation from, I suppose, across the hospital. We have clinical nursing staff, we have our lead physician, we have our lead non-consultant hospital doctor, we have HR representative from quality and patient safety. Who else is on it? Sort of a broad representation across the hospital to get all the viewpoints and to filter things out to all the different areas, bring the information together. And then we have different working groups then after that.
And how did you feel during the pandemic? Was it, how would you say, did you reallocate the tasks and responsibilities?
I suppose, as I say, the focus, as everybody has mentioned, couldn't be on Magnet specifically. So yes, resources had to be reallocated. But I suppose from my position in the emergency department, it was very clear people were redeployed. It was clear that people were willing to do what needed to be done. They showed themselves to be resilient, and I suppose Magnet then, as we were coming out of the pandemic, it was a way of sort of channeling that and a way of sort of building upon the fact that staff were open to change and how a means for us to retain the staff, as you were saying, it's a sort of a focus after the pandemic to hold on to our staff.
Yeah. I think that's really impressive because overall what we could see is with a lot of engagement, a lot of interest in the study despite the pandemic. So even during the pandemic, we received requests of new hospitals still to join the study, and in the beginning it was still possible. Of course, now towards the end it's difficult. But the numbers speak for themselves, so 60 or over 60 hospitals joining the study still during this kind of very spectacular and very special situation. It was very, very impressive to see the engagement also during monthly learning collaborators. They are still, like, next to joining our monthly meetings, they are still meeting frequently with their twinning partner. I'm not sure how often you would say you meet with them, because it's online, there are time differences. We have US hospitals from the east to the west coast, north and south US, so it's quite, there are quite some differences. So how often would you say do you meet with your twinning partner?
We're meeting once a month.
And where is it? Like, which hospital is it?
It's the Luminous Health and Arundel Medical Center in Annapolis in Maryland, so on the East Coast.
On the East Coast.
Yeah, only 6 hours time change.
Okay. And you, Sonja?
The meeting for the coordinated groups, I think it's all, I didn't know it really sure. I think it's all in 14 days with the Ohio, the James in Ohio is the hospital, the twinning partner.
So I try to meet with the magnet coordinator, and it's the Marion Hospital in Rhode Island that we're twinned with. I try and meet her every fortnight, and then every month there's a bigger meeting where we all meet. We've been quite good at keeping in touch, actually.
Yeah. And they already came to visit you?
No,
Not yet.
not yet. They were actually, our twins were supposed to come this September, but they're still waiting for their accreditation. I'm not sure exactly what, it sounds like a hospital evaluation. They thought it would be done by now, but it hasn't been done, so they're coming in March, they say now.
Oh, wow. And did you already meet your training partner in person?
Yes, we met them last year because we visited them in Annapolis. But hopefully they are coming to Germany in December. And yes, yeah.
Yes, our members of the coordination group was in USA at the beginning of this year, and in I think it's in October they go again to the USA, and the twinning partner comes to us. I think it's in November, December. So we planned a face-to-face meeting in Germany.
It's exciting.
Yes.
Okay, I think we're coming already to our last part of the general discussion, where we want to look at the application, the implementation of the magnet model in the European context. I already mentioned it. I mean, it's a US concept. It's mainly implemented there. We can find several hundred magnet-designated hospitals there. It has a big history. We can find a few outside of the US too. In Europe, it's mainly Belgium, like Antwerp. I think there's one or two that got Pathway, which is a kind of separate, like another concept, also provided by the ANCC in the UK. But like in general, how would you assess, you have worked with Magnet now for quite some time, like over 3.5 years now. How would you assess so far, is the concept transferable to European hospitals, to the European context, or specifically to Germany? Sonja, what would you say?
I think it's some aspects are very difficult. If you think about the education and nursing, and if you compare it with the other countries, especially USA or Ireland or UK, it is very different very difficult for the German hospitals to get the academization rate nurses at the top management, but at the wards. And then we talked about in the morning about digitalization, and this is in the hospital, our hospital became the digital Akte.
The digital file. The digital file?
Patient file.
Patient file. And so in other hospitals in Germany, I think they have to do or have to make more in the kind of digitalization. And if we want to, speak about benchmarking, about pressure ulcer faults and so on, so we can't the aspects of Magnet, wir können es nicht erfüllen. We can't
meet the the main requirements of Magnet.
So there are a little bit. So I think it's very difficult to get the high Magnet principles to fill it.
Yeah, because Magnet has been developed
in
for like several decades now in the US. So like Europe is starting now, where actually the US have been 20 years ago, like even more, even longer.
But those are the two limitations that are essential, I would say. Its first part is the academic level of nurses. I think Magnet requires at least 80% of academic nurses. In Germany, that is nearly impossible to achieve ever. So that's really a big limitation, and I think you know it, Dorothea. We address this requirement very often during the learning collaboratives and everything, and I think the ANCC now understood that for European and German hospitals, this is a requirement we cannot fulfill. So we hopefully have to work on the Magnet manual and find a way to, I don't know, make a European way out of it that fits our requirements that we have in the healthcare system in Europe. And the second part is the benchmark, which is also how to achieve also for you guys in Ireland, because we don't have this national database that we need to benchmark our nurse-sensitive indicators in Germany and also in other European countries. We're now building up this database. There was a small initiative of hospitals out of the Magnet study who tried to build up this platform, and we're now on a very good level for that, but it is hard work, and it will take a lot of time to be go further to achieve the requirements of Magnet.
Yeah.
I would agree with all of that. I think those are the limitations within the European context, definitely the benchmarking and the educational requirements that are very specific within the Magnet manual. I would also say that a difference that we have noted, and I think it's more common across Europe, but when communicating with our twin hospital, the Magnet model is just focused on nurses, and within Magnet for Europe, with the staff survey and that we've been trying to include physicians, and within our project, I suppose, within our hospital, we've been trying to include physicians as well. But I think, and our staff survey has shown that, and what we already know, that there's great teamwork between doctors and nurses within our organisation, but not only that, there's great teamwork between all of our organisation and all the different staff that work within the organisation. I feel the Magnet model as it stands and our context anyway is limiting. I think something that focuses on all staff is more, it's certainly more Irish. It's certainly more is something that we would like to do, and I suppose a lot of our interventions do benefit all staff, but when you're communicating the Magnet model, it's very much the Magnet model is a model for nursing, so it's exclusive. It actually excludes some cohorts of staff, so I think there's an opportunity there for sort of a wider incorporation of staff within a European context.
Mm. We already touched upon it, but if you would summarize them, where do you see the main advantages or possibilities for Europe of Magnet?
to me, the most potential lies in the way that we collaborate with each other. So Magnet gives us a lot of structures, a lot of tools to collaborate with one another. So and it's the ultimate chance also for German hospitals, where the healthcare system is much more or much centered on the physician, that we open this kind of view and say, okay, who's involved in caring for the patient? It's not only the physician, it's the nurse, it's the therapist, it's assisting staff, so everything who's caring for the patient. And it's absolutely important to cooperate closely together. And with Magnet, we have the ultimate chance to do that. If we open up the view and say it's not only for nurses, it's those principles can be general for all members of the organization. And I think that's the key.
Puts it very good together. Sonja, would you like to add something?
Yes, I think a very good thing from the Magnet principle is the professionalization of nursing. So we tried at the KBR to implement academic nursing, and with the power of Magnet principles and to improve the quality of care. So it's a very good benefit. And also I think the digitalization is a very, very good benefit, so we can compare us with other clinics and we can look, okay, which quality we have and where we want to go, and that's very good.
Yeah. Anything to add, Marie?
So yeah, I suppose the main possibilities, and sort of they're already showing themselves to be true, is a kind of change in our culture and our hierarchical structure. So our councils now, our nursing councils are giving the voice to the staff on the ground, and it's proven to be very beneficial to the organisation. And I think people are starting to see that within the organisation, is listen to your staff, and it just provides the structure for staff to have a voice, and to have that forum with management, to bring ideas on how to. Everybody's focus is the patient at the end of the day. Everybody wants the same thing. Everybody wants quality care. We also want to retain our staff, and Magnet provides the structure to do both of those things. We know that staff are engaged when they're involved, and when they're listened to. So it is improving care for the patient, but also engaging and motivating the staff. So yeah.
Yeah. And now I mentioned it in the presentation. The main aim or the main goal of this project is really to improve the work environment, to improve the working conditions for clinicians, and to improve their mental health and well-being. But of course, we already saw it like during the project. When it comes to working with the twinning partner, a question that always comes up is, are you going for Magnet? Is the idea to go for the Magnet designation? So I would actually now be interested, like, do you want to share something? Is your hospital considering the option to go for Magnet designation in the end?
I suppose for all the reasons discussed, it's not possible at this point to go for Magnet designation. But I suppose we had a bit of a light bulb moment, as it was described by the presenter herself at the Magnet for Europe conference, where one of the Irish hospitals actually had been at the Magnet conference in America and had attended a talk on the ANCC Pathway to Excellence programme. So when you look, it's another accreditation by the American Nurses Credentialing Centre, all along the same journey, along the same lines, but it actually takes out the benchmarking, and it takes out the educational requirements for staff. It very much focuses on the structures, and for us anyway, that's what we have been focusing on. So it focuses on the structures, how staff are supported. It focuses very much on well-being, and it's everything that we're doing, and it feels achievable for us. So we've actually, after coming back from Oslo, we have set up 3 working groups focused on the pathway to excellence standards, so with the view to going for pathway accreditation, which will hopefully lead to magnet accreditation in the future. I think short-term magnet accreditation is not possible for us, but certainly in the future it would still be a vision, but in the interim we're hoping to work towards pathway status.
Maria already explained it. So Pathway for Excellence is a different accreditation program provided by the ANCC. The ANCC was very generous also in providing this manual too to us during the project. The focus so far was really on magnet, but indeed, as you said, the requirements are a little bit different. I wouldn't necessarily say less strict, but as you said, it's more focused on the structures, the educational requirements, which are especially difficult to meet in Germany when it comes to magnet. They're a little bit different, but overall, the idea is also to improve organizational structures, quality of care, the work environment for nursing professionals.
So magnet designation is not our first aim as Bergmannstrost. We are using magnet and the tools and the framework that magnet gives us to strive organizational change and organizational development. And I think that's what we all need to do. It's a total cultural change that we are facing. And I think that's way enough for the organization, you know, and for staff. So, but still, we're working closely on the manual. We're trying to meet the requirements because maybe someday we can welcome the ANCC auditors and say, hi. So it's a goal maybe for the next 10 years, but it's not the reason why we are doing it.
Yeah.
Maybe that answers your question.
Yeah, absolutely.
So we actually discuss also the accreditation to pathway to excellence, as you explained. Because yes, we like to go to the magnet accreditation, but it's not possible in the next time, and so we get another step ahead. But the principles to magnet, we also work at this point, and we have learned a lot about things, and I think we can improve quality of care with all the aspects with magnet, and maybe we go the way as pathway to excellence and as a first step to the next accreditation to magnet.
Yeah. Okay. Thank you so much for sharing your first experiences in general, like on the project, how you started off in your hospitals. Now I think it would be very interesting to see, okay, how does it really look in practice? What kind of activities does it involve? We already heard you're working with the magnet manual, which sets out some different things, etc. And from there, you probably started off, developed some initiatives in your different hospitals. I'm not sure who wants to start, but perhaps you brought some ideas for the audience today just to share what you're currently working on or your main flagship in your hospital.
Well, I'll start then. I suppose we're quite a remote hospital in the northwest of Ireland. We would have, I suppose, traditional issues with recruitment, more to do with our location, I suppose, and lack of infrastructure. I suppose a lot of our focus, as I say, we kind of really launched Magnet for Europe to the staff and on International Nurses Day in 2022, which was also the start of the launch of the staff survey. So we actually put a lot of focus on what we heard from staff via the staff survey. So we were following obviously the magnet interventions, but focusing very much on prioritising what was a priority for our staff. So the main things we found in our staff survey were, well, staffing levels. That I think that's common across all the European hospitals. Staff felt that they wanted more staff to get the job done. We are implementing the safe staffing framework in Ireland at the moment, and our hospital has also is in the process of piloting the Safe Care programme, which looks at not only staffing levels per unit, but also looks at day-to-day, or it's 3 times a day, look at the acuity and dependency within the unit and bases the staffing levels on that. So I suppose that's in response to the main thing that staff were saying, that they wanted more staff, and I think that's common across Europe. What our staff also said was that they wanted to be more involved in hospital internal governance, and they wanted management to listen and respond to their concerns. So we have set up nursing councils within the organisation. So at the minute we have a staff nurse council. We also have a C&M council, a clinical nurse manager council, and I suppose they're providing the voice for staff. We're also have ensured that there's nursing representation on all our committees, hospital level committees, so that is just to give the nursing voice throughout the organisation. The councils are proven to be very beneficial, as I mentioned. Sort of staff are coming up with solutions to problems, and it's flattening the organisational structure somewhat. We're also focusing, I suppose, looking at when you look at the Magnet model and you look at assess the organisations via the gap analysis, it's not just the gaps that you're noticing. You're also noticing the good things about the organisation. So it became very clear that there's actually wonderful things happening within the organisation in various areas throughout the organisation. It's not always communicated well, never mind to an external audience, but within ourselves. I think we're not very good at blowing our own trumpets or sort of saying that we're great. But there's a lot of things great in our hospital, and that became very clear by utilising the Magnet manual. It created a focus on the things we're doing well, and we wanted to very much for our staff to focus on the things that they are doing well. So we've done a lot of things. I suppose it nearly feels like we've gone off a little bit from, but it's all part of it. We've got funding for big screen in our main concourse area that is kind of for staff celebration and communication. We found that communication isn't great within our organisation, so we're using the screen to communicate things to staff, but to also celebrate. This research has been done at your hospital. You know, this nurse got an award for this thing that pathway that she developed. Trying to create a buzz around the good things that we're doing. We've also signed up to the DAISY Award, which is an award for nursing excellence. Again, just trying to reiterate that there are good things happening, and for our staff to feel good about themselves. I suppose the other thing that came out of our staff survey, which was kind of surprising, I suppose, to us when we looked at the real data, but our staff felt that there wasn't opportunities for advancement within our organisation. But when we actually pulled the data, there actually were an awful lot of promotional opportunities, both clinical and non-clinical, for our nursing staff. So we needed to delve into that further. I mean, what was really going on? Why did staff feel that there was no opportunities for them within the organisation? Because that to us, as I said, we're kind of a remote hospital, it was quite alarming. We wanted to retain our staff. So I suppose when we discussed that finding with staff, what we found were a few things. There was a lack of confidence within our nursing staff to go for new roles. The interview process was intimidating to them. Even the application form was intimidating to them. They said that they would start an application and then not continue with it because it felt intimidating.
Also for internal applications?
Internal, yeah. So lack of confidence, I suppose, but also lack of awareness that there were opportunities. So it wasn't being communicated well that there were opportunities for advancement. So again, I suppose we tried to target those things. We've started sessions for interview preparation, but also sessions on filling out the application form. Again, on our screen, we are ensuring, and via our social media app, ensuring the staff are aware that there are opportunities, that what jobs are coming up, what jobs are available, but also via our nurse management, we are trying to get them to encourage staff that might be interested. So yeah.
It's very interesting. I think I really like the point, the one item that you pointed out, because Magnet in general is about good organizational practice. We put it under the Magnet model, but in fact those are principles that really stand for good organizational practice. And sometimes we're when it comes to the Magnet manual, sometimes one is so focused on different things that other good things that are already taking place that are simply overlooked. I really liked what you were raising, that the gap analysis already also showed you where you are, what are the areas where you're actually good at already, and they're not just gaps, and not everything needs to be improved from zero or from scratch. How's it at Bergmannstrost, Marion? You're probably working on many initiatives, having many activities in place, but
yes.
If you have an example.
There are many activities taking place, but one that I'd like to highlight today is our Transition to Practice program. Transition to Practice is a core tenet to Magnet because it gives orientation, it gives information to new employees, and it's the first impression of your organization that new employees get. So it's absolutely necessary to focus on that. And when we filled out the gap analysis within Magnet, we've seen 2 gaps actually within the transition to practice. Transition to practice to me consists of 2 things. The first thing is the onboarding process. So the first impression people get when they inform themselves about the organization, and when it comes to contract and they start their job. So maybe the first week of time in the organization. And the second part is the transition to practice at the ward. So what is taking place when people come to the ward, meet their colleagues, and get involved in the organization. And today I'm going to focus on the onboarding. Because even before we had a little onboarding process, so it's not that we started from zero, but our onboarding looked like that we had a welcome day for new employees. It took place every 3 months. It lasted 1 day, and it mainly consisted of the necessary trainings. For example, fire alarming, fire protection, data protection. So, all of these necessary trainings that need to be done. Of course, they need to be done. But the feedback that we gained from new employees was, it's not interesting enough. The welcoming is much too late. If you start in January, the new job, and the welcoming day is in March, warm welcome. So, and the wards also said that it's hard for them to outplan the staff when they are onboarded and they are part of the team. Then it's hard for them to send them out for 1 day and say, okay, you are away today. So we thought we had to work on that. And so what was very present to us was that onboarding is a huge step in retaining staff, because most of the staff leaves the organization within the first 6 months of the stay. The first 6 months, they are so essential. And that's why we said we have to work on this onboarding or welcoming culture at our organization. And we set up a little interprofessional working group, and they created a concept. The leader was one of our nurse managers who was responsible for this, and our HR development department. And the concept that we now have for our onboarding is a 4-day intense onboarding week. It's almost a week. Mm-hmm. It takes part every month at the beginning of the month, when usually most of our staff is starting their jobs. So it's on point. And the wards know that for those 4 days, the stuff is out planned. So they know, for those 4 days, I don't have my new employee at the ward. They are in the onboarding week, and in this 4 days, they get everything they need, and then they come to the ward on the day 5, and they are prepared with everything. And this was very hard to implement, and also to communicate with the nurse managers, the leading physicians, and everybody in the organization. But it works. And just to name a few elements of this onboarding week, what we do. First, we have a warm welcoming by our top management. It's always point 1 in the agenda. Then we have a little speed dating, so that the people can get to know each other. And what you have to know is that the group of people in the onboarding week are always, it's everybody that has a new contract in our organization. So it's interprofessional. It doesn't matter if it's a nurse, if it's a young physician, just finishing his or her studies and then starting a new job at Bergmannstrost, or if it's a member of the administration. So everybody is involved in there. It's interprofessional. And that was our vision for this concept, to say interprofessional cooperation starts at day 1. And so it's often very interesting to see how the speed dating goes on, because you don't feel any hierarchy in the room. It's just like you and me getting to know each other, and that's it fits perfect. We also have elements like we have a guided tour around the hospital, which is very, very important for orientation. Even me, as I'm there for 6 years at Bergmannstrost, and I don't know every room in the cellar, for example. And it's very, very, very important for the orientation just to know where to find things. People get everything they need during those 4 days. So they get their staff cards, they get meal cards, they get their keys, they get their clothing, they get a package of everything, and just say, okay, now you can start working. We have a so-called who we are. So every ward is going to introduce themselves in a short presentation, and the presentation is either done by a nurse from the ward, or by a physician, or by a therapist representing their ward, so that everybody in the room knows, okay, we have like those surgical areas, we have the ICU, we have all those departments that are important to know. And of course we have trainings as well. So we also included, of course, the necessary trainings, the fire alarming, and also data protection, but they are a bit shorter than before. And prospectively, we want to do them online as e-learning to make it shorter during those 4 days. And additionally, the new employees get an intense training in basic life support, medical devices, and also in our informational system, the KISS system that we use. The last day of the onboarding week is for reflection and feedback. And for that, we designed a little world cafe. So we usually have like 4 tables. The tables are moderated by experienced members of staff, for example, a nurse manager or a leading physician or a member of the administration. Each table has a specific question, and it's like a little outlook for the new employees of, for example, what is exciting for you to see within the next few weeks. And it's very great to see. I had the pleasure to moderate one of those tables sometimes, and when you come to when you moderate the table, you feel that the people are already a little group. There's a dynamic in the room, and it's like they know each other because they spend 4 days together getting all of this information, all of this training, and they are like a little network has evolved. And that's so great to see. And that's also the feedback that we gain from all of the new employees that took part in the onboarding week, that they have never seen or never had anything like this before in another hospital. That they feel so much appreciated, they're so thankful for that, and they have their first orientation and are also enculturated at our Bergmannstrost spirit. And that's our onboarding week. We're doing it since November 2022, so almost 1 year. And of course, we are continuously working on the agenda. There are always things to improve, but all over, I would say it's a very good thing, and we gain great feedback. And what we do now is we want to evaluate it, of course. We're doing feedback, or asking employees for feedback, but what we want to do is to also evaluate after 6 months of stay, for example. How good would you say was the onboarding week? How much help did you to get involved in the organization? And we want to ask new employees, but also the leaders of the wards, how the onboarding helped them to also onboard the new employees. Yeah.
I think that's pretty inspiring. Thank you. Sonja, how's it at Bremerhaven?
Yes, I'd like to give some overview about the project. Maybe you can, the next, yes, genau, this is the right slide. So I want to give you some overview of our project. On the one hand, we have, at first time, I think, from the participants of Germany, from the Magnet for Europe study, we developed the professional practice model. So there we have, with the project team, we...
I have, 1 second, I have a little bit of background noises. Or is it just me?
It's gone.
No, it's
there?
back hall.
Sorry for the interruption, please.
So we have more than 100 semi-structured interviews with nurses and doctors we conducted, and based on these results of the interviews, we developed the professional practice model. Because Bremerhaven is near the North Sea, and so we developed a picture. Sorry, I didn't give others with us, but we have we developed a picture and with the key factors for the professional practice for our Klinikum, and then we published it in articles and in the internet and the newspapers for the employees. And the very next big step for us was the nursing strategy plan. It doesn't exist before, and this we developed this for 2 years, for 2022 and 2023. And this we always publish this in the internet so everybody can read it, and it's for the transparency. And for us, it is very important, the education and professionalization in nursing. So we start with implementation of advanced practice nursing before we get a member of the Magnet for Europe study, and with the advanced practice nurses, and we've got nursing scientists and bachelor niveau, and a midwifery expert. And so we built the research board, and in this group the goal is to develop professional of care, and we had a lot of standards in the hospital, and we revised them. We started with some themes from the somatic care, maybe, transurethraler Dauerkatheter.
the standard of care. Yeah, I don't know the word, sorry. And we developed pressure ulcer prevention. So the nursing scientists get all the new experience and evidence of what we have to do with pressure ulcer, and so we develop new documents, new assessment, and this is the main points in the research board, that we check the standards that we have, and we get up of the new evidence-based nursing, and so we developed a pathway in which way we develop the next standards, and this will be a project for the next years because there are a lot of standards in this way. And also that we said it about the big theme is the big data. We developed a data bank that we can build up the pressure ulcer, the falls, and the nosocomial infections, and so we can compare with other clinics, and we have the big data board in the intranet, so everybody can look at that, and we can see in January so much we have, and in March it is maybe better and best things. And we have a very big point of evidence-based nursing, and so we have a main point also in education. We have on one side the school for nursing, it's a Ausbildung, and then we also developed trainee programs to integrate the bachelor nurses, and this is the main thing we do. Actually, we have 3 trainee programs instead actual, and we have a trainee program for nursing management. It goes about 2 years, and we have a structural plan for the members. They started their studium, they study and with the bachelor in management, and we also have a trainee program for education, because we have also less teachers for nursing, and so we want to do we want to develop the nursing school, and so we need more teachers for nursing. So there we have also a program for 2 years, and the new trainee program to integrate really the bachelor absolvents on the wards. We developed a 2 years project. The bachelors will work for a half year on the ward and look at every area which compares to the general surgery, and then they will start project, and they have supervising with the APNs and the nursing scientists of bachelor level, so they have a backup and they can develop their own projects on this way. And also we started with the implementation of advanced practice nursing, and there we revised our concept, and we also developed a traineeship or apprenticeship for advanced practice nurses. So in Germany we have absolvents from bachelor to master directly, and they have no experience in a specialized area. And so actually we have advanced practice nurses in the branch of mental health care and of critical care, and in these special areas we can improve this, but it's also possible to get their own specialized areas. Maybe if somebody wants to go to oncology, so we can do it, and we will unterstützen,
To support.
to support the studies in this project. And this, so our goal is, the main key is the education and to develop the professional of care.
Which is a main topic in Germany as well.
Yes.
Thank you so much. I think that was very interesting and again very inspiring. Like I always love to hear the individual stories and especially initiatives. There are just so many. But now I would also like to invite, because I'm looking at the time, and if none of you else have something to add still, I think we could actually open now the room, or like, and I invite the audience to ask some questions if you have any questions for the panel members.
Yeah, hello. Kohnen, I work with the BGW. My question is, if a hospital wanted to participate in the program, what would be the first steps and what would they have to do in the first year? Is there anything mandatory, or how would it get started?
In the Magnet for Europe program, or to go for Magnet designation?
Maybe Magnet for Europe.
So Magnet for Europe started in, it's a research study which is funded by the European Commission, and it started in January 2020, so we're like with 4.5 years in total, we're almost at the end of the study. So at this moment in time, it's not possible to join anymore, but still, like if a hospital would be very interested to work with one of the partner institutions, the first step would be indeed to contact one of the consortium members, like one of the universities that is mainly leading in the different country, to contact them and to ask them for opportunities to, for instance, work with the gap analysis tool, etc. That would be a first step. Does this answer the question?
Maybe I was maybe aiming at the other thing, like if you want to become with the certificate the certificate by the American standard.
Mm-hmm. Then the first step would be indeed to reach out to the ANCC and to request the documents to start with the application form. But it's really, like it's a long journey. So if a hospital really starts from scratch working with the magnet model, it can be a journey of 6 years, if not more, depending on the status, on the current status of the hospital. Or I'm not sure if someone else wants to add.
I just want to welcome you to chat together, maybe after our plenum here, to talk about what you might see for opportunities for your hospital, and also we can share some experiences of our journey so far, if you like.
Maybe the first steps are to look at the gap analysis, some points, not the whole gap analysis, but there you can find some important things, or you can see, oh, this, we have a gap, and so what can we do in this part?
Because the magnet manual is like a 400-page manual. It's like, if you start reading, you come to page 10 and then you finish it. So maybe it's better to just get together and share experiences of what we've gained so far. Yeah.
Yeah. Any other question? Yeah, I see there.
Hello. Thank you for your presentation so far. I'm interested in the marketing that may or may not happen. How do possible applicants know that a hospital is magnet certified, and what that actually means for them if they want to become a member of the staff?
I suppose none of us are magnet accredited hospitals. In the States, in America, it is very prestigious, and it is known throughout America and Middle Eastern, some of the Saudi Arabia and different countries. Our twin hospital has been magnet accredited 6 times, I think, which means they've been a magnet hospital for 24 years, and it very much shows within their retention. They really retain their staff, and staff are actively want to work there. They're actively looking for jobs in it. I think all the evidence from magnet hospitals would show that. But for ourselves, I suppose, even being part of Magnet for Europe, for us is a kind of a marketing strategy, or it's a pull for staff. We feel we make it very clear that we're participating in this project, and the potential benefits for staff and patients from that. So I suppose we try to communicate that with our new staff and our potential staff. Do you?
Yes, we do it. We do it too, and we also had applicants for nursing who said during their meeting with us when we first met for the job that they came here because of Magnet. But you have to also keep in mind that Magnet is not that common in Germany so far. So it's just a small group of people who knows what it is. But the people who know what it is about are much attracted to it.
Okay, thank you.
We would have as well, or we would have surveyed our final year student nurses back as they were going into the year, and they all said they were leaving. None of them were staying, but we have actually sort of actively tried to get them involved in some of our initiatives, and actually we've had a huge amount of them now stay, and they are saying that Magnet for Europe is a big part of that.
I'm also looking at you, Miriam. I know we have some people joining online. Are there any questions online from the audience?
Yeah, for sure. I think there was one more question in the audience, but maybe just one other question first, because it kind of goes in a similar direction. I don't know if you guys know, is there a follow-up project? So someone already asked, how can hospital get involved? And also, is it planned in other European countries as well, maybe?
So at this point in time, the idea is to have a follow-up. We're still trying to really define and develop the plan how to. We have sent in a research proposal, which has not been successful, unfortunately. But the idea is, that was also the idea, to create this huge network, that we're still keeping this network alive. We're now looking into other opportunities and options to really keep this project really alive, because it has a big potential, and I think we made quite a journey. We came far in this project, so we really want to keep this going.
Okay, maybe back to the audience first, give them a chance, and then I have a couple more if we have more time.
Thank you very much. My question went in a similar direction, so it may be already answered. But thank you for your time and your presentation.
Okay, perfect. So 2 for 1. So there's one for the group as well. What do you think would have been different if COVID hadn't happened? Almost philosophical question, if you like.
Well, for our hospital, I feel we'd be 2 years ahead. Now, I feel like it stalled everything.
I would agree with that. I think we could be much further if we wouldn't have COVID. But COVID is no excuse for the things we didn't achieve so far. Yes, 2 years ahead. Yeah.
Mm-hmm. Yeah, so I can also tell, like, from a research perspective, the idea was really to start with the official intervention, I think, in month 3, and we started in October. The survey was supposed to start also in month 3, and it started in November, like month 11. And the idea was normally to have a measurement, like to survey the staff in all the hospitals for 6 to 8 weeks. We stopped in July 2021, so we had a 9-month period. It was also then interrupted by some cyber attacks, etc. But anyway, it was a huge delay, and that's why, so the initial duration was actually 4 years. So we asked the European Commission to have a no-cost extension of 6 months.
Okay, and then I think it was in relation to what Marion said about the onboarding week. So do the project partners share their individual aspects, for example? So you all have been talking about what is special in your hospital. Do you share that? Do you see maybe others adapting something of your idea?
Yeah, we're sharing our ideas in different meetings. Dorothea just said we have the learning collaboratives every month taking place. You can actively bring in your ideas from your own hospital, things that you want to present or share with the others. And this is always great to see how far the other hospitals are, what they're working on, what challenges they face. And usually the challenges are quite the same at every hospital. So yeah, that's a really good point. And then we have the learning collaboratives where we meet in presence, so not online. And those are good for networking and then sharing ideas. Yeah. So that's our platforms, and I would say besides that, we also have little networks that just arose out of this Magnet for Europe project. We have a small group of German hospitals meeting sometimes to talk about the benchmark initiative, for example, besides the learning collaborative. So it's there's much exchange in this group. Yeah.
Yeah, I would agree.
Okay. We have one which is a bit more Germany specific, because maybe also for the international audience or someone online, there is a big reform coming up for the hospital systems in Germany. And the question is, how might that interact with the magnet concept?
That's very hard to say, because we don't know what the reform might look like specifically. But I think it's not in congruence with one another. I hope so, because the reform is much about the requirements regarding the financial system, and also the requirements for different qualification levels of staff that you need to fulfill. That goes in line with Magnet. I think we're looking in the same direction. But what the reform specifically means for each and every hospital, it's quite hard to see. Or just my point of view.
Yeah.
I think there's a question in the back.
Thank you very much for the very interesting informations. Did you evaluate the outcomes for patients, and what are the results?
I suppose there's the overall project that Dorothea will be able to tell you, the evaluating the outcomes for the patients within all the hospitals, within the entire project. But for ourselves and our individual hospitals, that has been a focus for us. I suppose bringing together the data, as you were talking about, and we've set up working groups based on the nurse-sensitive clinical indicators. So we have a pressure injuries working group, we have a falls working group, so there's various interventions at the minute being introduced and different new documentation in relation to those. So the focus is on the patient, but no, we don't have outcome data as such yet. We're just still doing the interventions in relation, but the focus is on the data. But I know, Dorothea, from a Magnet for your point of view,
From a research perspective, we requested the data for 2019 and 2022. So we have set in the ethics application because it's a big application process to request the data. We wanted to rule out most of the COVID impact. So I can't present any concrete data today, but we're collecting it. Any further questions? You're also welcome to ask them in German, and we will be happy to translate them. over there, I see in the back.
Thank you so much for your interesting insights in the project. I would like to add a question, sticking to the question before, because the political reform in the health sector in Germany might be a big thing in the future. Do you think the Magnet for Europe or the Magnet for, especially for Germany concept, might lead to a situation where just the big ones, the maybe level 1 hospitals, can afford a Magnet for Europe concept? And what does happen to the smaller ones? So do the nurses, especially the people, stick to the Magnet hospitals and the smaller ones lose even more nurses in the future?
I hope not, personally. What we see in the US, maybe it's not comparable, I know, but in the US you have a lot of hospitals that are Magnet designated, from huge hospitals up to very small hospitals that are outside of the big cities or areas where many people live. So I think it's also possible, of course, for small hospitals to achieve the designation. But what I can't look in the future and say what is the political reform that we're going to face in the next month is going to look like. So, and I'm not a politician, sorry for that. But I would say it's, of course, Magnet is an achievable goal for every hospital, no matter if you're a small or a big hospital, because when you look at the components of Magnet, they are about well-being, they are about the health of the staff, they are about development structures and good clinical practice and shared decision-making. I think those are principles that are important for every hospital, no matter if you are small or big. Hope does that answer your question?
Yes, actually it does, because in the first side it seems you need a lot of money, a lot of time, a lot of human resources to build up this project. So it's a good view that it's possible for the smaller ones as well. Thank you.
Okay, now I have to admit I was so involved in this discussion I forgot the time. So we're a little bit overdue already, but I would really like to thank the panel members for sharing your insight for this great discussion. I think it was very interesting, also for the audience, for the interesting questions, and for joining the session, and also to the BGW Forum for giving us the floor and the stage to present the project. Thank you.